Thank you everybody. I am Dr. Ardhendu Chatterjee. My Facebooks are Free Homeopathic Study, Ardhendu Chatterjee, Ardhendu Chatterjee, Jeevandeep, City India Homeopathy. I am now going to discuss about the diseases of the old persons. Today I am discussing something about the clinical use of homeopathy, that is the literature part. What we have to follow, we have to study in every case of old person. When a old fellow is coming, we have to take the details of the case history as usual of the child and other female and young, everything. And more cautiously, pulse, pressure, temperature, blood pressure, pulse rate, we have to be written and weight. And after detailed case taking, we have to take the first interest of the patient, that is what is to be relievable. If a patient comes with cough, whether it is essential to relieve or not, if the patient has hypertension, whether it is relievable or not, if the patient came with acute pain of knees, whether it is relievable or not. Yes, in case of rheumatic complaint, acute pain of knees, we have to be cautious. Every time after application of medicine, we have to note down the pulse, temperature, blood pressure. If any pulse rate seems down, treatment should be stopped, because any time at that time patient may develop severe bradycardia and the pacemaker may be necessitated. Our view is to give a prolonged peaceful life to a patient. So we have to note such points every time. And as the old persons are coming in town area, when they are treating with other medicines, they are taking allopathic medicine for pressure, they are taking thyroid problem, they are taking sugar problem, that very difficult to withdraw. So during the allopathic treatment, they are often coming to treat their different other problem homeopathically. So, during the treatment with allopathic medicine, it is also very difficult to follow the observations of Dr. Kent. While every patient, old patients, are like incurable patient, only relievable patient, and like the observation number 7. Anyhow, personally, I am follow the Hahnemannian tenets. What is curable to the patient? Which symptoms we have to cover first? First is pulse rate. If it is high, that must be down. If it is low, that must be up. Bradycardia condition, if we check the bradycardia, pulse rate increased, every almost 90% complaint patient relieved. I have seen during the COVID period, more 100 cases came, and Cotalasor, according to the symptoms of toxemia, mainly Cotalasor, also other patient, other medicine also patient, Cotalasor, according to the symptoms of toxemia and bradycardia, I applied, and I have got marvelous result. Every patient were cured. Even by phone, they wanted my advice, and I told them, you may try Cotalasor. Anyhow, second important is down of hypertension. Patient is coming with hypertension. We have to relieve the condition. Acutely hypertension relieving drugs. We have many drugs such as mainly aconite and arnica. If there is any violence or patient comes with malignant hypertension, only aconite 200 5 minutes interval, 2 minutes interval, 15 minutes interval, or 1 m or 10 m or 50 m relieves the condition. And some doctors also telling that about the arnica montana, no symptoms, but patient develop cerebrovascular accident, stroke, and arnica montana relieves the condition. Dr. Espide, he learned us very successfully. And patient lies to left side. It is also drinks at midnight, water, drinks water, thirsty at midnight. Platina relieves acute hypertension cases on that symptoms. And muriatic acid lies on left side. Glonian lies on right side, relieves the acute conditions. During the case taking, during the asking, every symptoms we have to classify it into three directions: related to the mathematica, related to the medicine, related to the miasm. Suppose patient, an old patient came with hypertension. Patient used to lie on right side. Lachesis, tabacum, phosphorus, glonian, sorinum. Lachesis means that may be a group of lachesis. If there is bradycardia, after giving lachesis, when the pressure is down, we may start cotrelosor. If there is any cardiac pathology, we may start nausea. Like that, if there is burning of abdomen relieved by cold drinks, we may start the treatment with Elapscor. These are the practical processing we are carrying, and we are relieving many patients. Thank you. We will meet next time.